In this video, we're going to talk about arthritis, which is what happens when your body changes its ligaments. When we're young, a little smile there, our ligaments, which are the little rubber bands that hold your bones together, are all full of a springy elastic material called elastin. And as we get older, the elastin in these ligaments gets replaced with a less springy material called fibrin. And then your body lays calcium down on top of that fibrin just to hold your bones together. And that process of changing from elastin to fibrin and then laying some calcium down on the fibrin can lead to an increase in the tissue in your spinal canal, and that can cause squeezing on the nerves or your spinal cord. Okay, so when we were young, our bones were tied together with little rubber bandy things called ligaments. You can't really see them on this model, so I'll just draw them in for you here. Anytime the bones touch, they're held together by things called ligaments. And these ligaments, up to about the age of, say, 25 years, are made of a chemical called elastin, which is wonderful stuff. It's very springy. This is a front view over here. Here's a side view. And again, all these bones are tied together by ligaments that are very springy, and they're made out of elastin. That's all well and good. But you got to remember that 2 million years ago, when we were running around the savannah, okay, as a group of proto-hominids, 25 years was about as much as you got. By the time you were a 25-year-old proto-hominid, okay, you weren't running quite as fast as the rest of the herd, and as a result, you would become food for a group of lions that were also running around the savannah. So really your design specs were to live to be about 25 years old, and then the lion would help you recycle your carbon. Okay. Then came fire, then came social networks, and finally we started living longer than 25 years of age, okay, well beyond our design specs. So what happens in that case is these ligaments, the chemical in these ligaments starts changing from elastin, which is nice and springy, to fibrin, fiber, which is not nearly as springy. And then the bones start slipping past each other, and as they slip past each other, the fibrin being kind of floppy and inelastic doesn't help them spring back, and your body just hates that. Your body does not want your bones slipping past each other. So it sort of MacGyvers things together. It kind of duct tapes your joints together by laying down extra ligament wherever there are joints in your body, wherever two bones touch, and then it lays calcium down inside that ligament, and that ties your body together very nicely. It says, look, if we can't have an elastic connection between those bones, that's okay. We'll just put a solid connection between those bones. And in fact, it keeps your head on your shoulders pretty well. Trouble with that, of course, comes when all that extra tissue your body is laying down around the joints starts pushing on the hole that your nerve uses to get out of your spine. Okay? Remember, this is a little hole that the nerve uses to get out of the spine. Technical terms, it's a foramen, Latin word for hole. Okay? And then also remember, you have your spinal cord sitting back here, running through that big hole, that big canal in the back of your spine. And what's going to happen to your spinal cord as your body starts laying down all that extra ligament and calcium trying to hold itself together? Exactly. Your spinal cord is now at least potentially going to start getting squeezed as well. And all that extra tissue, all that extra fibrin, all that extra calcium is what we call, technically, arthritis. This is a normal process your body uses to hold itself together as we get older, as we pass about 25 years of age. However, that arthritis, that normal process, can squeeze on your spinal cord and cause problems. It can also squeeze on the nerves coming out of your spine and cause problems. Okay, so quick review. Arthritis is a normal process when the elastin we had in our ligaments when we were young gets replaced by fibrin, and then that fibrin gets calcium in it, and that combination of fibrin and calcium and ligament and stuff that your body uses to tie itself together can squeeze on the nerves or squeeze on your spinal cord. Okay, so that's it for our discussion of arthritis, in particular as it relates to the spine. For more information about arthritis, anterior cervical discectomy, endoscopic carpal tunnel, and other topics, please visit us at cnysspinegroup.com. We'll see you next time.